Hello all, I'm Janelle Jones with OFA and welcome today to May's Collective TA session. We're gonna focus a little on LI square communication and prevention strategies. We'll be joined today by Ella, one of the site coaches, and we'll also be joined by Marissa Kaiser, a Senior Director of Communications from KC Family Programs. So I will turn it over to Ella to get us started. Thank you all for joining us.
Thank you, Janelle. Could I have the next slide, please, Casey? Great. So let's talk about our goals for today. And then I'm going to talk a little bit about Marissa. She might be a little surprised by that, but I'm going to. So one of the things that we've talked about in this learning community is that there are some challenges with communication when we're undertaking kind of these complex projects and partnerships. So one of the goals for today is to understand and identify what are some practical ways of being a strategic communicator as TANF and Child Welfare Program leaders work together to effect change. And then we also want to talk about how do you develop an action plan for one thing you can do individually, collectively, to strengthen communication with a key audience or partner or someone related to the work that you're doing around prevention. So to kind of have this conversation and do some deeper thinking, we invited Marissa Kaiser to be a part of this conversation. And what's interesting is that I almost had contact with Marissa in my prior life when I was at Larimer County, and we were actually working with Vroom to help parents when they were thinking about how do they support brain development in their children. So Marissa and I just missed each other. And then we have another point of connection, and that when we think about LI squared, learn, innovate, improve, Marissa is actually the one who suggested that when we think about communication, let's put it in the context of a model we're already using, in which she has also used learn, innovate, improve. So Marissa Kaiser is the senior, let me see if I get this right, Senior Director of Communication with the KC Families Foundation. And we are thrilled to have her here and to be able to co-facilitate this session. And so Marissa, welcome, and we are thrilled again to have you.
Thanks for that warm welcome, Ella and all. I had a brief moment before in the room together to chat with a couple of the organizers of the FAST-LC, and I'm just honestly so impressed. This is a really cool project, and I'm happy to be invited into this space. So thank you guys for having me. So yes, I am a Senior Director of Communications at KC Family Programs. I've been with KC about 5 years, and as Ella inferred, I worked at a different organization prior to that, focused on early childhood and running an initiative called Vroom, like a car goes vroom. And it was fun to work in that space, especially for a program that was aptly named as an onomatopoeia, something that is said in most early child development, processes, and regardless of culture or background. We've heard Trevor Noah talk about playing with bricks and making the car go vroom vroom. So anyway, I've transitioned into the child welfare space, but always worked in communications. And the communications team at KC Family Programs, I often describe it as a corporate communications team. So we're really focused on aiding the CEO, the executive team, the board in communicating with staff. Again, corporate communications, kind of internal communications, but we do get to do some external communications as well. We produce an annual signature report. Some of your jurisdictions may have run into, especially in the child welfare space, the Public Information Officers Learning Collaborative, which is run through the Georgetown University Center for Juvenile Justice Reform and is in partnership with the Annie E. Casey Foundation, so Casey Cousins, and Justice Policy Institute. I also run a group that's a little more ad hoc, and we call ourselves the Narrative Change Work Group. And it was created during the pandemic, really formed to push back against harmful narratives, or what we perceived as harmful narratives, that if children were not in school and the mandated reporters did not have eyes on those children, that they were somehow less safe. And I think this whole group gathers together. That's exactly right, Dr. Marcia. It's totally part of Ellen Gonski's work as well. So yay, yay, yay. Back to the narrative change group, right? Like, I think this whole group can galvanize around the idea that families are actually the answer, and we're all working to support families in some way, shape, or form. And we want families to thrive and children to be more safe and more able to reach their potential in the context of families. And we know from child development that's really important. And I thought that was apt because, you know, it's a collaboration with a lot of national partners. You know, the Annie KPC Foundation is also part of that, Chapin Hall, the National Association for the Council of Children, Children's Trust Fund Alliance, the American Bar Association, Social Current are within our reach. So lots of organizations really come together to talk about narrative change. And I understand this is a bit of a conundrum for this group. But what I love actually about, first of all, John McKay reaching out to me is that he brought me back into the days of Vroom and brought me back into the days of LI squared. And Ella's going to really, you know, dive us a little deeper into the LI squared process. But I just want to talk a little bit about this, my experiences with the LI squared. And hopefully it can help us as we move into this next slide will be a reflection. Hopefully it can help you guys ground the idea in the idea that, like, we all have agency here and we can all do something, even in the field of strategic communication, which we may feel very uncomfortable about. So I'm going to take you back to the days where I worked at the Bezos Family Foundation and ran Vroom. And I got to attend a Washington State early learning collaborative meeting. And it brought together, remember the days before the pandemic when everyone came physically together in a room? So all the counties in Washington that had these early learning initiatives were showing up, and they all sat in tables according to their county. I happened to be placed, because I was working for a funder, I happened to be placed at the Skagit County table. And through the LI squared process, we were really trying to tackle, like, what is our problem in early childhood education or in early learning? And for this group at Skagit County, they were saying, we have so many good assets in this community. The problem is awareness. Okay, and then what's the next question is, you know, what's our solution? The solution that this group came up with, problem is awareness. The solution is, if Oprah could share about our initiatives, we would really solve our problems. And I think we've all been in spaces where we were like, I bet if Oprah featured me on her, you know, she doesn't have as many shows anymore in a magazine or something like that, my initiative, we could just blow this out of the water. The other answers were like, okay, if not Oprah, did you guys know Chris Pratt owns land here in this space in the Skagit County, Washington? Chris Pratt, many of you guys maybe know him as Star-Lord, or Peter Quill in the Avengers Guardians of the Galaxy series, or he was the voice of Mario, big Hollywood actor. So yeah, if Chris Pratt would talk about us, this would be the answer to our problems. And we went through then the learning, innovating, and improving process of LI squared, and really came up with a completely different answer. And so what ultimately Skagit County realized was that we actually hold the solutions. We just have to think about it in a different way. Hopefully LI squared today can be a framework in that way for strategic communications. Okay, that's my intro. I've already talked too long. Let's move into a reflective space together. So think about prevention and how you communicate about your work. How do you talk about your work in prevention? What is it that you want others to understand about prevention? What do you use in the way of examples to help people understand? And really, I want you to, like, every single one of us, lots of us are showing ourselves, but lots more of us are on video. And I know that runs the risk of multitasking, but here's the deal. Think about a time when you've shared about your prevention work. How did it go? What resonated? What seemed not to land? What seemed challenging? Let's talk about this. Let's think about this. We'll have a chance in our breakouts to like dive deeper into this, but this is our grounding reflection. If I could provide awesome classical music to get our juices flowing, I would. Instead, I'm going to hand this back to Ella.
Be helpful if I could mute myself effectively, talk about communication. All right, so if you can share in the chat, or if a couple of folks are willing to share out loud, we'd love to hear from you. Like to share. I'd rather not call on folks, but I can.
I'll break the ice with an example of my own, right? Oh, and look, we're already starting to populate. And this will give time for lots of folks to type their answers in the chat or be willing to go off mute. So here's the funny thing about the work that we do. If you're ever at a party and people say, what do you do? Or what industry do you work in? I used to say early childhood in my previous life, and they were like, oh, tell me more. And, you know, then you think preschool, you think babies, you think, oh, this is lovely. And there was sort of this mental map that people could draw to the work. When I go to a party and I say I work in child welfare, nobody asks a follow-up question. Oh, good for you is the answer. So it's even harder to talk about I work in child welfare because I believe in prevention. Let me tell you about prevention, and then I can talk about, you know, temporary assistance for needy families or women, infant children. Like there's so many SNAP. I can talk about those things if they're willing to pull that conversation thread. It's really hard to actually get into a conversation about this. But yeah, that's my cocktail party moment. My husband, by the way, makes bourbon for a living. We always get to talk about what he does.
And we have 3 answers already in the chat, or I think we're up to 4 now. Dana we talk about the risk for families with few resources or who live in communities that are under-resourced. Andrea says prevention stopping families from entering or continuing poverty by providing advocacy and resources before they need intervention from a crisis result. And Bernadette says, I want people to understand that prevention shouldn't be and won't be visible in the same way that services are. And Paige says, I found that talking about the return on investment can be a helpful strategy for garnering bipartisan support. Do you have any reflections on those, Marissa?
You can see my lips moving as you're reading them out loud. Yeah, that's good. And I think if you know sort of wove them all together, right, so that families don't have to come to the attention of the child welfare system, don't have to go into crisis. This is a worthwhile investment for everybody.
I'm wondering if we go ahead and move Marissa over to you for what is strategic communication?
let's do it. So, the deliberate and thoughtful planning that, like, you guys, I don't know this. Speaking of like party talk, this doesn't roll off my tongue. What is strategic communication? The deliberate and thoughtful planning, crafting, and dissemination of information. Okay, all right, there's some strategy there, there's some communication there, this kind of makes sense. But I like this next part, it goes deeper, right? It's beyond just information sharing. It's about building trust. It's about fostering understanding. It's about influencing perception. And really, we can influence by sharing some of the messages that we just shared in the chat. Maybe some stories about prevention. But the crux of it is that it is key to building positive relationships with key stakeholders and the general public, and shaping the success of your initiative or effort. So I love this comprehensive definition of strategic communications, because it's about relationships. Strategic communication is relational. And hopefully we can tie back to relationships as we dive a little bit more into thinking about strategic communications. I saw something pop up in the chat and I loved it. Folks don't necessarily believe their return on investment, and it's true. And that's why storytelling can be a little bit more compelling.
Marissa?
Yes.
So I was going to say, I think the most important piece of this definition, if you will, is that middle part. Like you said, it's about building that trust. So I think that's where the strategicness comes in, if there is such a word, strategic. But anyway, so I'm a professor, I make up words all the time. But anyway, so it goes beyond the sharing of information. It's really about building that trust. So I do that all the time with my students. So you have to be very deliberate and intentional, right, about the words you choose. And so that to me, that's the most important piece of the whole definition, is that building that trust and then helping people to understand that you're genuine, right? And then that then I think influences how they perceive what you're saying. But yeah, I like the definition, because sometimes we don't always think about this one, because you know, we use strategic communication in a variety of different genres, a variety of different ways, a variety of different, you know, doesn't matter whether you're in business or you're in nonprofit or you're in family services. All right, doesn't matter, but the communication should still be genuine about building relationships. So thank you for defining it that way, and not a business focused way, if you will.
Yeah, we are in business, but it's heart business. And hopefully what this definition starts to frame for all of us is that we can all do strategic communications.
And I think one of the things that you talked about, Marissa, when we were preparing for this, is that sometimes people want a communications officer to impart the message. And what you talked about earlier is that each and every one of us should feel like that we have the ability to convey. We might want to think about it. We want to think about those trusting relationships, building those positive relationships with key stakeholders, and then really plan out what we want to say and how we might want to impart that. So I'm wondering if we can move to the next slide and start talking about LI squared and how is this related to strategic communication. All right, and Marissa's going to go into this in more detail, and she's going to break it down step by step. But let's talk about LI squared, a model with which we are familiar: learn, innovate, improve. So when we do the learn phase, it's really about understanding what's the motivation for change, what does the environment look like, who are the folks who are involved, and then we're going to clarify and understand, and this goes again to Marissa's point about those relationships and trusts, who are the key audiences that we want to communicate with? What is the purpose of our communication? Why are we communicating? And then that will inform much more of the process. So we figure that out first. And sometimes we get a little frustrated because we spend some time in the learn phase. But if we shortcut that, the learn phase, we might be solving for the wrong problem or thinking about our audience maybe not as expansively as we could. So then we've got that figured out. We move to the innovate phase. And one of the conversations Marissa and I had is that when we think about LI squared, when we think about communication or other processes, this can be an ongoing journey because you're thinking about different ways of coming up with solutions to challenges. You want to craft your approach. What is the best method for communicating? And there might be more than one. It could be that your audience needs different mechanisms to be effectively communicated with. So how might you best do that? What's your methodology? There might be some research evidence that's helpful here. And it could be that you have some new ideas that you want to test out. Then when we think about the improved phase, is you're thinking about how did it go? We communicated. What did we learn when we communicated? Oh, we could do this better potentially. We might want to refine this process. And then we might change something. So what we think about LI squared is it is a cycle, and that when we get on this journey, it can be an ongoing journey where we continue to learn, improve, innovate. So Marissa, do you want to add anything? And I said it wrong. Learn, innovate, improve. Wrong way. Do you want to add anything to this?
When you're going cyclically, you can go backwards too, right? That's acceptable. Ella, thank you. You did say and call out. A lot of times we want a communications professional or a communications plan to tell us what to do. But much like the Skagit County folks realize that Oprah or Chris Pratt was not the answer to their real problem. I hope as we go through this and think about where we are, where we sit, what our partnership looks like, what this learning community can do together, that we realize that a communications professional or capacity from our Health and Human Services Department, internal support, a PIO is not necessary for this. We can actually make really good strategic communications progress by thinking through this framework. So let's go a little bit deeper. I'm just going to talk through a couple of initiatives by going through these slides, and then we will have a chance in our breakouts to get a little more personal, a little more tactical to what we're working on. So I thought of a couple of topics. We're going to cover all these and we can, hit the rewind button and go backwards. But why prevention is a really good big question. What's the purpose? Well, the purpose of our communication is to talk about prevention. And so what is the desired outcome of this? Oh, Miguel Wamasu. So what is the desired outcome in understanding about prevention? I mean, maybe it is so that there's just a shared understanding. That's one worthy goal. It's my desired outcome, shared understanding about prevention. But also maybe there's something deeper. Maybe it's an actual, maybe we're talking about family first, and we want to be able to leverage funds in a different way so that we can use family first dollars, child welfare dollars on prevention initiative, and it's a coordination between between a couple of different agencies. Let's keep going, clarifying our purpose. Go to the next slide. Okay, understanding our audience. This is what I'm gonna need your guys' help on, right? Who am I communicating with? So you've got the desire, you've clarified your purpose, our purpose. Figuring out your audience is sometimes really tough because you're just like, I want everyone to understand this. Absolutely. But who's your real audience? In this specific case, maybe you're literally like, I want the secretary to understand this. Maybe it's intra-agency, maybe it's your own staff. Let's name our audience. And then let's figure out, okay, what do we know about them? What's especially important to them? What are their values? What are their needs? What are their wishes? Let's tailor our message according to that audience. And actually that leads us to the next slide. Message, we're going to tailor our message according to our audience. As soon as we very clearly understand who our audience is, then we can figure out, all right, I know what I want. I know what my purpose is. I know what my audience is. What's the message that's going to resonate with them? And this is where some good thought comes in. And you can imagine we're going to innovate on this, but we're also going to try this a couple different times. We're going to innovate and we're going to improve. We're going to innovate, we're going to improve. We're going to innovate, we're going to improve. We're going to keep thinking and refining these key messages. It's important to figure out, like, what is your primary call to action? Like, we've already figured out in the first slide what's our purpose and what's our desired outcome. But so how are we going to phrase that to our audience? And what information is essential to support this key message? And let's go to improve. Oh, sorry, we're still innovating here. Okay, how? Is it an email? I think oftentimes we come up with a really stellar message, and we can all apply this to our personal lives, right? A stellar message delivered over Facebook is probably not going to get your desired response. You're not changing hearts and minds. Back to that relationship. So how might I best share this message? Is it a meeting and then there's a follow-up email? Is it actually a report? Maybe it's a report. How might the audience best receive this message? That's about innovating and figuring it out. Is there one more slide? No. Okay, we can go back. Thanks, Casey Gray. I'm not making it easy for you. Let's jump around. let's actually go back to that purpose slide and think, a little bit more. I mentioned family first is one interesting possibility. I'm going to give you one more example. I'm looking at the time here, and I've got good timing here. And I'm going to share from my my work at Casey Family Programs, and it's another partnership with the Annie E. Casey Foundation, as well as Prevent Child Abuse America. Some of you on the child welfare side may be familiar with the Thriving Families, Safer Children initiative. And me as a communications professional, this is how it often happens. The first I ever heard about Thriving Families, Safer Children was from some of my colleagues, and they had been thinking for years about what they really wanted to galvanize. By the way, I'm going to share with you a little peek under the hood. Thriving Families, Safer Children is a phenomenal initiative, but when it got to my desk, it was called, so first of all, the ask was, can you send out a press release this Friday on this proof of concept? And so your communications professionals kind of came in and you're like, okay, well, why are we sending out a press release? And what's your desired outcome? And they're like, well, we've worked so hard on this, and we want everyone to know that we're doing something great. You're like, great, but it's also currently called proof of concept. And I don't think it's going to really turn heads that way. that kind of gets a little further on the slides. But so we honed, like, why are we going to communicate this? It is kind of a big deal when Casey Family Programs, Annie Casey Foundation, the Children's Bureau, and Prevent Child Abuse America come together to form something and to work so that can turn heads. What's the desired outcome? The desired outcome was really they had named a cohort of early adopters, and they wanted more community-led initiatives to join on a statewide basis for technical assistance, kind of like here we are in this room today. So let's go to the next slide. And ultimately, we were like, is a press release really the answer? And the answer was no, because the people we need to communicate with, as I mentioned, were like, yes, they were jurisdictional leaders, but they were also they were community-based organizations. They were folks with lived experience with the child welfare system that wanted to change the system, that wanted to work with a jurisdictional partner and a community-based organization to really shift how things functioned on and really change the prevention landscape. So press release was probably not the right way to do it, but it was one element of the plan. Ultimately, the hard work was being done on the ground. You know, what's especially important to them, we wanted to identify shared values. We wanted to name shared values, community-led, lived experience-led. And when we thought about wishes and fears, gosh, you think about lived experience working together with an agency, working together with community-based partners. There's lots of wishes and fears. That list goes long. So we had to write that out, realizing that like these are things to be very aware of as we think about our communication. Let's go to that next slide. Ultimately, when we came to craft a message, and even just like what is thriving families, safer children, it's, you know, sort of, it led with first of its kind. But ultimately it's a big prevention initiative that brings parties to a safe table, but it set the table for those parties to come together. And what's the primary call to action? Well, there was the big value proposition of like changing the way the current system functions. But the primary call to action was, would you come to this table? And in terms of information that's essential to share, you know, who else is at the table and what efforts are being made to truly create an equitable space. And that's tough. That's really tough. How did we share this message? This is the next slide. Most of it was not through a press release. Most of it was done through a lot of work on the ground, meeting face-to-face, phone calls, group conversations. And it was very rarely the agency partner that was the lead on delivering these messages. And because of recognition that a lot of those historical fears would thwart the receptivity of that message. So that's one example of going through the LI squared model. It's almost a shared model, LI squared and PAM, purpose, audience, message, and method. But I think this is actually a great time, right on time, to think about breakout sessions. Before we actually transition to breakouts, I want to ask, is there any clarifying questions that we might want to address in a bigger group? Maybe that means we'll transition and ask for questions in small group settings. But also, let's get our thinking caps on. Let's think about how we might do this for ourselves. questions? Casey Gray, I think you've automatically broken us out.
Okay, great. I just chatted out the questions for the breakouts, and I will go ahead and open up these rooms. It'll be self-select, just like we typically do. So you'll just want to go to the bottom of your Zoom window, click on the little 3 dots for more, and then find your group. So please let me know if you need any help. You can send me a chat or you can just speak up.
Welcome back, folks. So let's talk about how was that experience in terms of talking about communication, something particular to your experience in this work. Is Marissa back in the room?
I'm right here. Hi there. Hey. Yeah, I got to be with the Kentucky folks, and it was just such a delightful experience. Sarah
Wonderful.
mentioned uplifted, feels energized.
Do you want to talk a little bit about that, or somebody from Kentucky with you?
Yeah, there's lots of people.
Hello. Hi, I'm Margaret Perkins from Kentucky, and I am actually within the Division of Prevention and Community Wellbeing. We are very fortunate in Kentucky that we have a new division of prevention, which really allows us to spend more time and to think and really strategize those prevention efforts. Prior to that, we were a branch within the Protection and Permanency Division. So prior to that, we were part of the, the typical what you think of as CPS. So creating the new branch really allowed us to place more emphasis on it and a focus. So, with our own leadership that has the same focus that we do. So it's super nice because we know what CPS leadership folks spend a lot of their time on, and prevention may not be their the top of their totem pole on a certain day with a lot of crisis that's going on. So it's very nice. Within that, it also allows us to think about prevention much more and how we can change. And so myself, I come from CPS fieldwork, and so the audience, I really we talk a lot about how we can send the message of prevention and how to help field staff be able to really kind of weave that into their work more, and with the understanding that we've been there and done that. It's crisis oriented, the hair's on fire, and then how we can somehow help them move upstream with prevention. So we do a lot of thoughts and thinking about that. And one of the things we kind of land with is, some small changes, which is trying to change the mindset of prevention and child welfare and help seeking and family preservation and things like that. So just one of the little examples we talked about is instead of high risk issues, really talking about opportunity for supports within families. We try to use that verbiage and to try to spread that messaging. In our system, we changed, instead of high risk category, we actually label it as opportunity for support. So then anyone who's filling out the box or looking at that box, instead of utilizing high risk, it's opportunity for supports. Messaging, we think that I can't remember this. I'm rambling now because I can't remember the order of the questions. But what I will say is that messaging, how to send that message out is even by small change. And if we can implement and send that through our system, so that when CI workers are entering that information, centralized intake, instead of seeing a box that says high risk, they see opportunity for support, and that's going to change that mindset of that information. So our focus on who needs prevention, everyone needs to hear about it, but when field staff can really absorb it and hear about it, I think it's really effective for our families. How we send that message out, I think it's important to talk about the benefits of prevention and prevention. Spending money in prevention saves money in the long term, right? And then we talk about how comparing that to the medical field and all of our prevention services. We receive, like preventative services that are covered by health insurance, and are free, and more people take advantage of them for that reason, right? So if we could jump on that bandwagon in child welfare, how beneficial it would be. I can't think of anything else that's kind of the highlights of some of our discussions.
Thank you, Margaret, for sharing that. Just out of curiosity, how many others think that being able to communicate more effectively with frontline staff would make a critical difference? If we could see just even a show of hands using the emoji. Okay, thanks, Bern. Does anybody want to talk about that or share why you think that's important in addition to what Margaret shared? Or if you want to share something else, that's fine too.
Another thing we talked about in our group, Ella, was if we're talking about families and the why, we want to change the image that they have of child welfare and TANF, for example, because they see them as the bad guys, but how can we change that image to be more supportive, maybe even hero, and that may be a stretch, but at least going in that direction. So, because when we think about the audience, so if the audience is families, we design and craft our message one way. The audience and internal staff, of course, we design and craft it another way. If external community at large, we design and craft it a different way. But just thinking about families, and what you said about the frontline staff, how they approach the families, how they talk with the families. Even when Margaret talked about checking the box, whether it's high risk versus opportunity for totally different mindset, and that changes the image, and that could also make a huge difference in how they even communicate with them. Because I remember there was a movie back in the day, Claudette, I think it was called Claudine or something, where the welfare worker came to the person's house and they had to, what do they do? They kind of put the TV under the bed. They put the radio in it because they didn't want them to know that it had all these things. So it's that same image that has been kind of permeated how people think about child welfare and TANF. Even though that was a long time ago, people still think that same way. And when you think about certain audiences, that's exactly what they think. And so changing that whole mindset, it really does start with the frontline staff. And so it's so important that they know that how valuable they are in the message, whatever strategic message we want to put out there. So yes.
Yes. I have another thought about that. And I thought about this a lot because I've been a line worker and, and all the different levels in child welfare. Now I'm outside child welfare trying to help guide their programs to, do this collaborative work. But I really think that the structure drives what our workers do, because I've seen a lot of workers very, very frustrated because they do believe in prevention and they do want to work with the families. Because especially our young people coming out of the MSW programs that we have, it really is, they want to do social work. And that's one of the things that we drive around this program called Linkages, is that you get to do social work, because the social work part is, you're working with these families to help strengthen the families and giving them resources. So it's not a hard sell to the worker. I found that the challenge is to get the leadership to make sure that there are the resources for that they can do this work. So we always talk about how when we do our TA guidance, we'll call it, with our counties, one of the first question we'll ask is where's your leadership on this? Is your leadership on board? Do you have support from your child welfare and your TANF? And we require, as part of being part of this collaborative, that their leadership assigns the coordinators from each one of those programs so that they're connected. Because if they don't give them the space to do the work, then it's not going to get done. And then what happens is we have people leaving the field like crazy because they came in wanting to do social work, and all they feel like they're doing is, taking children or, monitoring the court reports, that kind of work, which is important work. But what they came to do, I mean, really, what they came in this field for was to do social work, to work with families and trying to give them the opportunity, I think is what we need our leadership to understand. You've got to structure, you got to find the funding to make sure that they can, that you have the structure in place for them to do this kind of collaboration with their partners. If they don't have time to partner with their CalWorks or TANF worker around this work, it's not going to happen. So I think it's important to make sure your workers know, what you're trying to accomplish, communicating that. But I think it's just as important to have that structure in place because it's not going to happen.
And then in the chat, meeting people where they are and building from there, line staff can provide excellent insight as well as the families that we serve. What does a family need? Not what we think they need. And adding a cultural lens. So we've heard some common themes through these conversations. Those of you who know me know that I'm going to ask you to think about what is one step that you could take around communicating this work that you're doing around prevention. It doesn't have to be huge, but we also know that when we learn something and we actually apply it, it makes a difference because we have a chance to practice these skill sets. And it falls right in line with LI squared. So if you could take 2 minutes and write down what is something that you could do to practice this skill set, strategic communication around the work that you're doing in prevention. And then if you could, I'll give you 2 minutes. Could you share in the chat what is an idea that you have to practice strategic communication? So I'll be quiet now for 2 minutes. That's all. And then I'll come back online and ask for folks to share.
Can I just speak if it's okay with you? I'm a very, I'm a person that just wants, I have the thought, and I would, if it's okay, and if you want me to write it down, I don't mind writing it down.
Go ahead and speak. That's fine. Go ahead and share.
I want to help Margaret because I see Margaret, she did a lot of the talking as well. So from Kentucky, and I feel like I need to kind of put my input. I'm from family support as well. I've worked as a family support worker. So as you said, like communication, it starts with trust. I think it starts with, building trust. If there's trust between the client and you, and as a worker, then I guess they will be willing to openly talk to you about their issues and the problems. And then, and then if you're willing to help them, they will accept that help in a way where they understand that you are trying to help and not take away their privileges or their children or anything like that, or so I feel like it starts with trust. Communication, yes, it's there, we all talk, you and I are talking, this is communication. But if there's no trust there, if there's no foundation of that relationship, then you cannot, you can willingly you can try to help them, but they might not openly tell you the problem that they have. So for me, I think it's trust.
All right, so wondering if folks could begin to add in the chat, what is one idea that you have to practice this skill set? Just one idea. How might you communicate something about the prevention work that you're doing? Thank you, Andrea. We create communication buy-in videos with family success stories and trickle that up. Then we want to continue to trickle down the message that change in government is on the horizon. We need to make sure we are talking in such a way that everyone can understand, committing to ongoing communication about the work, not just one presentation and moving on. These are great. And so if folks could continue to add things in the chat, I want to take this opportunity to thank Marissa for being a part of our community here and sharing her vast knowledge about strategic communication. So Marissa and Janelle, do you have any closing words that you'd like to add?
I'll let Marissa go first, and then I'll close us out if she has anything.
Oh, that sounds great. I just want to express gratitude for y'all and the work and the thought. The heart is very, very, very clear. And sometimes we just need a little intention. And yes, learning and innovating and improving on that intention to meet our audience where they are, to communicate effectively one-to-one, one-to-many, through videos, up, down, across the organization, across agency. So thank you for your time and your intention and your thought, and honestly for the work you do every day. Thank you.
Yes, thank you. And I just echo that. Just continue to navigate the different communication strategies with your audience, with the states, tribes, our clients. So just continue that. And I know there's barriers, so just different strategies. And I would like to also thank Ella for moderating, and Marissa as well. Thank you so much, Ms. Kaiser. And thank you all for attending. And I hope you all were able to gather great takeaways. Thank you so much.